Hi there, I'm Dr. Brigid Norton. You can call me Brigid. This is Menopause Bytes, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, let's talk about premature ovarian insufficiency, or POI, a condition where periods stop before the age of 40. It's really important to understand that POI is not just about fertility issues and menopausal symptoms. It comes with serious health risks, so identifying and understanding it is key to minimizing those risks. Premature ovarian insufficiency was previously called premature ovarian failure, or POF. However, we've moved away from that term for many reasons, including because it's actually misleading. The ovaries haven't actually failed. They've just become less reliable, releasing eggs much less often. This can lead to symptoms like hot flashes and night sweats, reduced fertility, and irregular or absent periods. What causes POI? Well, we often don't know the answer to that question. However, it can be linked to genetic or autoimmune conditions, certain viral infections like HIV, some cancer treatments including radiation therapy and some chemotherapy, as well as surgeries involving the ovaries or the uterus. So, what leads us to test for POI, and what does testing actually involve? Well, if you're under the age of 40 and have skipped 3 or more periods, or your periods have suddenly become irregular, it's probably worth investigating. While POI isn't the most common cause of missed or erratic periods, pregnancy, thyroid issues, weight changes, and polycystic ovarian syndrome, or PCOS, are more typical. We'll run tests to rule out these and other possibilities, including POI. If you don't have periods due to a hormonal IUD or surgery like a hysterectomy or an ablation procedure, testing might still be indicated if you start experiencing menopausal symptoms like hot flashes or night sweats. Initial testing usually involves a pregnancy test, a thyroid panel, prolactin level, and an FSH level. Additional tests like estradiol, testosterone, DHEAS, and 17-hydroxyprogesterone may be added based on your symptoms. POI is diagnosed with 2 elevated FSH levels 4 to 6 weeks apart, as well as low estradiol levels. Once you're diagnosed with POI, further testing is usually indicated, including genetic screening, diabetes and HIV testing, adrenal insufficiency checks, and more thyroid testing. A baseline bone density scan is usually recommended, along with referrals for psychological support and fertility counseling if desired. As I mentioned before, POI poses significant long-term health risks beyond those of normal menopause, including a higher likelihood of osteoporosis, heart disease, stroke, and dementia. Menopausal symptoms and emotional challenges like an increased risk of depression can also be profound. So, early diagnosis and treatment are essential for managing these risks effectively. Treatment for POI falls into 4 key areas: pregnancy prevention if you don't want to conceive, fertility help if you do, reducing long-term health risks, and managing menopausal symptoms. Getting pregnant with POI is definitely challenging, but not impossible, with a 5 to 15% chance due to an occasional egg release. So if you don't want to get pregnant, reliable birth control is essential. If you do want to get pregnant, seeing a fertility specialist early is crucial. Hormone therapy is the cornerstone of managing menopausal symptoms and protecting against long-term health risks for women with POI. Hormone therapy in POI may involve hormonal birth control or menopausal hormone therapy. It's important to understand that even if you feel fine and aren't having menopausal symptoms, hormone therapy is vital for your overall health, and we recommend that you take hormone therapy until the typical age of menopause, which is age 51 to 52, after which we reassess on an individual basis. Most women can use hormone therapy, as contraindications are rare. For most women with POI, menopausal hormone therapy is preferred over estrogen-based birth control because it better protects bone health and reduces cardiovascular risk. However, since hormone replacement therapy doesn't prevent pregnancy, hormonal birth control may be a better option if contraception is needed. In POI, we call menopausal hormone therapy hormonal replacement therapy, or HRT, rather than hormone therapy. And that's because the goal is to actually replace hormone levels to those typical for women in their 30s and 40s, unlike standard menopausal therapy, which focuses only on symptom control. This often means starting with higher doses, such as the 0.1 milligram bioidentical estradiol patch or equivalent, For progesterone, we also prefer the bioidentical option, usually starting with a 200 mg nightly dose. Hormone levels are often monitored, unlike with regularly timed menopause, and that's because we are aiming for estradiol levels between 80 and 120 picograms per milliliter. This range is based on expert opinion and not on strong scientific data. If your estradiol levels are too low or your symptoms are not well controlled, we would increase the dose. Estrogen-based birth control like the pill, the patch, or the ring are a great option, especially if contraception is needed, or just because they feel more familiar to women in their 30s and 40s. If you're using estrogen-based birth control, we usually recommend skipping the placebo week to prevent menopausal symptoms in that hormone-free week. While estrogen-based birth control may offer less bone protection than hormone replacement therapy, it's still a practical and effective choice. For those who are using progesterone-only birth control options like the Mirena IUD, adding an estradiol patch can provide the estrogen component needed to protect your heart, your bones, and your brain, and to treat menopausal symptoms, and often is possible even if you can't take estrogen-based birth control. So that's it for another episode of Menopause Bytes. Here are some take-home bites to remember. Premature ovarian insufficiency is menopause before the age of 40 and is linked to health risks like osteoporosis, heart disease, dementia, and depression. Fertility is low but not zero, so use birth control if pregnancy is not the goal. Treatment with hormone therapy reduces health risks and treats menopausal symptoms. And finally, the main treatment is hormone replacement to premenopausal levels, using either menopausal hormone replacement therapy or hormonal birth control. Until next time, may your hot flashes be bearable, your nights restful, and may your courage never waver.